All right. Good evening. Together, optimistic at home. I'd like to think that if this kid can do it, we can all do it. And the strength that you see in this picture is a little bit of the strength that we all need, but we can see it out there. We can internalize it, and we will get through this. Again, every picture we saw there is the type of activity that we can do healthy at home. And again, with all the information that's out there, and make sure you turn it off for a large part of the day. And with all the social media out there, make sure you're not getting your news from social media. We want you to fill up social media with all of our hashtags, healthy at home, and as well as Team Kentucky, Together Kentucky, and hashtag Patriot, because following these guidelines, making sure that you engage in social distancing is your patriotic duty as an American, as a Kentuckian, and as a neighbor. This is how we get through this. This is how we protect the people around us. All right. So every week we've got good news, but just about every week we're going to have some news that is tough. And again, we got to breathe as we move through it. We believe today, and the news came out of Lexington, that we have our 4th death from the coronavirus. She's an 82-year-old woman who had underlying health conditions. But we are thinking about her and her family. Tonight, I'm going to light my house up green. And for everybody else out there who has that ability, we'd ask you to do it too. It's just a moment of solidarity where we're showing a color of compassion and of renewal, knowing that, in my faith, the body is just a vessel, and that person is going to move on to a better place. Let's make sure that we keep her family in our thoughts, in our minds, in our prayers. Regardless of our faith, let's try to lift them up. And then let's remember that we are taking all of these steps to protect real people who are counting on us. I'd also asked this last Sunday for bells to ring at 10 a.m., knowing that people who couldn't get to a service at their church or their mosque or their synagogue, that if those religions allow, having those bells ring at 10 a.m. would just remind people that they are still there. For those that are willing, we'd like you to ring your bells every morning now at 10 a.m. We're going to have a lot of people who are going to be working from home, or a lot of people who are going to be at home because they don't have the job they did before the coronavirus. Ringing those bells will just remind everybody that we are out there and that we care about them. Before I give the update on today, I want to invite Dr. Stephen Stack up to again talk about how, especially with this week and the weeks to come, it is incredibly important that we follow this guidance, and that, for lack of a better term, this is game time. This is the time where we all got to step up and prove we can do this, and the stakes are the health and the lives of those that we care about, but we can do it. Dr. Stack.
Thank you, Governor. Starting with a little positive, the weather outside today is beautiful. So hopefully we're going to get back sooner than later to the other public health stuff that I would love to talk to Kentuckians about: being physically active, getting ideal body weight where it needs to be, being healthy. So use this opportunity, which is admittedly challenging, to get outside and enjoy the great outdoors, because the trees are flowering and it's just a beautiful time to be out there. So I hope you'll do that. Now, I know the numbers the governor reports are getting bigger, but they still sound small. So I want to remind people why it's important to not be complacent and not to disregard the advice we're giving. If one person were to infect 3 people, and if it takes about 2 days for someone to be able to be infective, you could have one person go out and infect 3 new people, and 2 days later it's that one person will have infected 9 people, because those other 3 will have infected more. And then it becomes 27, then 81, then 243, and then 700 plus. And then by 12 days, you've got 1,000 people infected by one person. So these numbers that are small now, and when we tell you that the days ahead may become more difficult, it's because that math is kind of hard to really get your head around when you're not looking at a chart. But it's really, really important. So the governor has mentioned over the last number of press conferences where there have been individuals where people haven't done the things we've asked. I want to reframe that for you a little bit. Most people have done what we have asked, like the governor has said. And I want to thank you for that, because this is not just about ourselves, it's about everybody else. So if you think you're young and you're invincible and you can disregard the advice, you have an obligation to keep the people who are not as invincible and who could be hit very hard by this safe. Now, there's some new guidance that came out today, because we had some examples where some in the healthcare provision community still didn't seem to fully grasp what we were saying. So the guidance today says for the healthcare community, a different paradigm of emergent, urgent, and non-urgent, and that guidance is up on the website. But ultimately, we have to rely on the healthcare community and also just regular citizens to use their best judgment. And here's the way I would have you think about it. Whatever you're about to do, if someone gets infected with the coronavirus, and if 14 to 17 days later they're critically ill in an ICU, was whatever you did worth it? Was it worth what you did if someone else ends up on a ventilator in an intensive care unit? And I think that's how you have to think about it. Now, there are times when it is worth it. So if you go to a hospital and you're having a heart attack, you clearly need to have a cardiologist open up that blood vessel and save your heart. So that's worth it. But if it's just going out and hanging out with people, you know, playing cards or playing sports where you're all too close together, or getting together in a communal gathering hall, that may not be worth it. And you could infect a lot of people. And I said on the weekend my metaphors or analogies to help people understand. One person in the middle of a room full of people infects numerous people, and then it's like buckshot. It just scatters and it spreads. And the people going from place to place, folks who disregard the advice and they decide that they're going to go into other communities or they're going to go into people's homes and visit and do all those things, that's like a honeybee pollinating disease. So as the days ahead unfold, we are very sincerely hoping that all the steps we've taken are going to keep our curve as flat as it possibly can be. And I think we'll see over the next few weeks, hopefully, that the things we've done have been successful. So I want to thank you, because I continue to get stories, I'm sure the governor does and all of us do, about people volunteering to donate materials, people stepping up to offer to sew masks for folks if that'll help, people offering to donate their time and skill, people who manufacture components for things we need, like hand sanitizer, willing to donate a component if we can find the other components and get them put together to make hand sanitizer, people willing to bottle that stuff. So we're building whole supply chains to try to make the things that we need in Kentucky, but we're doing it with Kentucky people. And so I would say this is a great example where Team Kentucky is really rising to the challenge. And I think together Kentucky is going to overcome this. So I always want to remind that I thank the governor very much, because I think his leadership is what's helped us to stay really calm and rational, and to give you the factual information as best we're able to whenever we stand up here and talk to you. And we're committed to continue to do that, because I think together we're going to overcome this. It's just that we have to pull together to overcome it stronger at the end, and I believe we'll do that. So thank you very much.
Tell them about the med students.
Oh, I'm sorry, I forgot. So I wrote a letter and asked medical students in Kentucky to volunteer, and I had this morning 263 medical students. We have about 600 in the state, and we have 3 medical schools. So Pikeville, UK, and U of L. We have probably at this point close to 50% of all the medical students in the state have already volunteered to donate their time, their services, and themselves to help us as volunteers in the emergency response efforts. We're going to now solicit nursing students and others, and I suspect we're going to see the same wonderful spirit of sacrifice. And so thank you to the medical students. Thank you to John at University of Louisville, who recommended the idea. He's a medical student. And thank you for reminding me, Governor, because I'm very proud of that community and all the others who I know will step forward. So thank you.
Thank you. In another piece of good news today, we have the issue with the Small Business Association, the SBA's website, fixed. Kentucky small businesses that have been impacted by the coronavirus can now go online and apply for the disaster loans that they need. Okay, for Kentucky's update today on our numbers, we believe as we sit here now, we have 124 positive cases of the coronavirus, and those are 21 new cases since I believe I reported to you yesterday. Again, we expect the numbers to go up. Kenneth, if you will show St. Louis and Philadelphia, I know we look at this graph every day, but it shows us a couple of things. First, it shows the importance of the social distancing that we are doing. We are making sure that we do not have a number of cases spike to where they could overrun our healthcare system. And that makes sure that we keep those that we love with us and healthy. But even in the case where we are doing aggressive steps, hoping to be more like St. Louis than Philadelphia, understand that there is still a spike of cases. And that's what we believe that we are in. And we won't know until the end how exactly where we are on that spike just yet. But these 21 new cases are from all over the state. And again, we've talked, just because there isn't a positive confirmation in your county doesn't mean it's not in your county. This is in every county right now. It's about knowing that most people are asymptomatic but can still spread it, and making sure that even without a positive confirmation, you are doing what you should do to protect other people. So in the new cases, we have 1 from Allen County, 1 from Breathitt County, 3 more from Davies County, another from Fayette County, 2 more from Harrison County, 6 more from Jefferson County, 1 more from Scott, 1 from Simpson. We have 3 that we don't have a county on yet, and we have 1 in Warren. We also have 1 new lab that's come up that's called AIT Laboratories. And while the numbers I know will seem different as they come out each day, or maybe at different times of a day, understand that in many ways that's a good thing. As we have more labs come online and that information has to be pushed up to us, there's going to be some variance there in the numbers. But the more labs we have doing tests, the better it is for Kentucky. Now let's walk through some of the steps that we have taken and the new steps that we'll be announcing tonight. But just understand this week, given what the Surgeon General said and the World Health Organization, that as we move through the week, no, not necessarily today, we're going to have to take some more aggressive cases. If this is game time, we got to be up for it, we got to be ready for it, and we got to be willing to do what it takes to get through. So first, I declared a state of emergency. That activated the Emergency Management Operations Center along with the State Health Operations Center. We announced Kentucky's COVID hotline, 1-800-722-5725, as well as our website, kycovid19.ky.gov. Can we put up the website, Kenneth? So the website is incredibly important because it is the source to go to make sure that you have all the information on the coronavirus here in Kentucky. There's a reason we haven't put up an extra Twitter account or an extra Facebook account or anything else. We want one place that we can drive people to make sure they have the information that they need. And there is an infographic on this page about when to seek help and when to seek care. It has been adjusted, and I need to adjust the way that I talk about it because, admittedly, I had it a little bit wrong yesterday, and that's going to happen. So if you are well but nervous and you need information, we do want you to call our coronavirus hotline, 1-800-722-5725. I will admit that's different than what I told you yesterday, and that's on me, but as we move forward, we want to make sure that we're getting everybody to the right places. So if you are well, but you have questions, you are nervous, you can call that hotline. All right, if you are sick but would have otherwise not sought care but for the coronavirus, we do want you to call your healthcare provider, and it should be your normal healthcare provider. Do not go to a healthcare facility without calling the provider. We have to make sure that we do not see a healthcare system being overrun if it's just normal things that your healthcare provider can help you with. If you call the coronavirus hotline right now and you need care, but probably not for the coronavirus, we still have to get you to your local healthcare provider to get that care, but you need to call them and do not go in. But the third piece is, if you are truly sick and would have sought care, and if you are injured, absolutely go to the facility. We need to make sure that we take care of you. With the recommendation from our Secretary of State, our primary is now June 23rd, 2020. My commitment is if at that date it is not safe, we will not ask our poll workers to go in, especially since most of our poll workers are in the vulnerable population. We've protected health care and our most vulnerable Kentuckians. That's issuing executive orders and initiating changes to Medicaid to make sure that this testing and treatment will ultimately be free. We've limited visits to long-term care facilities. We've allowed pharmacists to re-up orders for 30 days, and we're going to do it again. We have taken steps to force home isolation when originally a Nelson County a patient initially refused to self-quarantine. Now, I learned today that they had to get an order for a Louisville man who refused to self-quarantine after testing positive. Now, I know I've used these press conferences at different times to point out bad actors to try to make sure people will be good actors. Don't be this guy. Now, if you know them, and I believe their name was even published, it shouldn't have been. Listen, as long as they're doing the right thing now, we got to have compassion, and it doesn't help to pile on. But we have a duty, an absolute duty, to make sure we are not spreading this coronavirus. So don't be the person who tests positive, who refuses to do the self-isolation. We will take the steps necessary from the state and from your jurisdiction to make sure you do the right thing if you refuse to. But also don't be the groups looking for the exception or the exemption. And we'll provide more detail on the retail order we put out last night. But trying to argue for every way you should not have to comply versus realizing what we're in makes it hard for other people around to do their part. This is a time that is bigger than our bottom line. It's putting the lives of our people over profits. This is a time when we prove we are a great generation and that we can come together to do the right thing to protect our people. Now is our test, and I believe that we will pass it. But it's going to take everybody taking a deep breath when suddenly it's their business or their group, and understanding that this is something we all got to do together. We've issued guidance to support good mental health. Make sure that you look at that. This is going to be tough as we get through to make sure that we're as healthy as we need to be when we come out of it. And then we've issued an executive order to cease all elective medical procedures. While I think there was some pushback early on, I have seen everybody coming on board. I mentioned chiropractors yesterday. I do want to say their association has come out strongly supportive of the steps we are taking. We appreciate you. We know a small group of anybody can create bad publicity for the larger group. We are encouraging statewide social distancing and, in fact, have orders out of it. We have had to ban all mass gatherings. We've encouraged business to allow people to work from home. Remember, the best chance to continue to operate through all of this, no matter what type of entity you are, is to be innovative and to find ways that you can do what you need to do with people working from home. Now, we've had to close a lot of facilities to protect Kentuckians, and this has been hard on a lot of people, but let me tell you, seeing people step up and understand the sacrifice has been something really special. And for all those businesses that are doing it willingly, and are even supporting the steps, thank you, and I hope your community will lift you up and help as this continues. That's included schools being out until at least April 20th. It includes restaurants and bars being closed to in-person traffic, child care centers closing with exceptions for certain essential personnel, public-facing businesses that encourage public congregation being closed. And then yesterday's that all in-person retail business that are not life-sustaining are closed as of 8 o'clock tonight. Now, let's be clear again. The following will absolutely be open, and there's no need to rush today before 8 o'clock. Grocery stores are going to continue to be open throughout whatever we are dealing with. No matter what, your grocery store will be open. There will be an opportunity to get the supplies you need. Remember that our test here is being a good neighbor and not taking more than we need. Shop for a week, not for a month, because that next person behind you needs what they need for the week as well. Pharmacies will be open, banks, hardware stores, gas stations, and other business that provide staple goods. A list of in-person retail businesses that are open is up on the website. Let's go through some things, though, that will be closed as of 8 p.m. tonight. Entertainment, sporting goods, clothing, shoe, jewelry, and furniture store, florists, bookstores, and we've gotten a lot of questions on this today. Auto dealers. Auto dealers will still be able to provide repairs and parts, and if they can do a sale completely through the internet or phone, they can continue to do that. But we're at a point in time where we cannot have the direct interaction out on the lot, bring somebody into a room, do the negotiation, send them over to financing. We cannot do all of that. We're at a time that requires everyone to step up, to sacrifice, and please, it's time, if you want to continue to sell, be innovative, figure out how to do all of it remotely. That can be continued, but the otherwise in-person sales cannot. Retail businesses that are allowed to stay open still have to follow the CDC guidelines, still have to spread people out. And if they cannot, individual action may be taken by those stores or may be taken with those stores or businesses. Let me give one final clarification. All stores related to agriculture supplies or equipment or our food chain, as it goes up from the very beginning, are going to stay open. If you are an ag-related business, you can always call us, but we need you during this time to make sure that we have enough, again, to feed all of our people, and we are going to do that throughout all of this. We've provided and will continue to provide what economic relief we can for people as we go through this. That's waiving the period for work search requirements on unemployment and making changes so that many who are now unemployed who have lost benefits can immediately apply for Medicaid. We've announced that banks are financially strong and well capitalized, that our food chain is safe. We have the SBA news today. We've moved the tax filing to July 15th. We've extended the executive order on price gouging. For anybody whose government benefits were going to expire in the next couple months, they're being extended by 3 months. Let's say again that there is no stigma to public assistance as we move through this. Everybody is going to need help. This is the challenge of our lifetimes. None of us have ever lived through something like this. Make sure that you get the help that you need. I want to make sure we put up unemployment slides so that people know that we are taking steps and that there is also a schedule for this week that is really important. First, a couple steps. We're changing our parameters on how we're handling mass layoffs. Any employer with at least 50 employees who is laying off 15 employees is encouraged to file a claim on their behalf through the e-claims processing. That helps make sure that people get their unemployment faster. It's something that a business that wishes they weren't having to do what they are having to do can help their employees, can cut down on employee paperwork, and make sure they're getting their benefits right away. We released new regional telephone numbers for Kentuckians to call with unemployment questions. These are up here. They will also be on our website. They're going to help you to get your help a little bit faster. At a time of anxiety, we know you don't want to have to wait on the phone. Please be patient with us, but we will do the best we can. And beginning on Monday, the day that someone files an unemployment claim will be different based on their last name. This is going to help us make sure that, again, we can cut down on your wait time. I know things are already tough enough, and that make sure that you file on your day. You will not be penalized by having to wait the extra day for your name to come up. We've trained 138 workers just this last week from all different cabinets on what's called claims adjudication. So many people who have filed will get something saying their claim has to be adjudicated. We have more people now ready to do that than ever. And we are thankful for everybody from across state government who volunteered to stop the job they were currently doing to be there for our people at the time that we need them. We are going to train many, many more. We're also working on those areas that are still hiring during this process and trying to drive as many people as we can to them. We are still trying to lead as a state by closing our capital to in-person business as well as all of our government sites. Again, we're not going to let that penalize anybody. Anything that needs to be, that would expire, we're going to re-up. Anything that needs in-person, we're going to do remotely. We're going to make sure that government is here for people during this time of need. All right, couple new things tonight. First thing I want to announce is our Team Kentucky Fund. This just went live today, and it is an opportunity to make sure that we can help with as many of the sacrifices that people are making as possible. For some, medically advised social distancing means losing unemployment or working fewer hours, and the loss of income can be difficult. It makes us worry about our utility bills and how we're going to put food on the table. In these tough times, I took executive action to create the Team Kentucky Fund. The Team Kentucky Fund, to the extent people donate to it, will help provide financial assistance to Kentuckians whose employment has been affected by this virus. The fund will be overseen by the Kentucky Public Protection Cabinet, meaning we will be able to trace every dollar that goes in and comes out and make sure that we are using this for the highest and the best fund. The fund will work like most popular fundraising platforms. You can log on, click a couple buttons, and give instantly. I'm inviting all Kentuckians who can, and Kentucky businesses and friends, to make a hashtag Team Kentucky contribution. We know realistically we will not be able to provide for every Kentuckian that is lost, but we can make a difference in people's lives in ways that will be incredibly meaningful to each and every one of those people. Now, you have a lot of options in how to help that's out there right now, but I can tell you the Team Kentucky Fund will be monitored at all times through our government resources and will provide a safe opportunity for people to donate, knowing that those dollars are going to go to people who need it. The great news is that donations to the fund are tax deductible. I want to thank our Secretary, Carrie Harvey, and Kentucky Interactive for helping to make this possible, and we hope that everyone will go on and help right now. There are no limits. Every penny helps, whether it's $19 to fight COVID-19 or whether it is any other contribution. It's incredibly important. Second new thing to announce tonight is we've had a number of questions from the public and from in here about how to report circumstances that we believe are dangerous, about people being too close together, about groups not engaging in social distancing, sometimes about a business that has not taken any steps to make sure that it happens. So we now have a COVID-19 reporting hotline. Okay, that number is 1-833-KY-SAFER, 1-833-597-2337, and that'll go up on the website, 1-833-597-2337, or 1-833-KY-SAFER. Those who are not in compliance with our state orders, this is a call that can allow government to know. It's going to be staffed by Labor Cabinet employees. Right now, we're going to have it open from 7:30 a.m. to 9 p.m., and you can leave messages after hours. This is an opportunity to make sure that we know what you know. We expect a lot of calls. Again, be patient to us and with us, and every call might not be actionable. Also want to let people know that as we believe that cases are going to ramp up, we're going to take some security measures around our Kentucky hospitals just to make sure everything is orderly and make sure that everybody in there, from the practitioners to the patients, are safe. So you'll be seeing additional law enforcement, local and state, at our hospitals, and you'll be seeing here in the near future some National Guard that are posted there as well. Again, this isn't about enforcing any type of curfew. It's not about circling anybody's neighborhood. I just want to make sure that if we see that scenario where our hospitals and our medical centers have a surge, that we can take care of everyone in the most orderly fashion, and everybody knows that while they're there, they are safe and that they will get the help that they need. I want to encourage, in a next step, all radio stations and TV stations that are out there to start doing PSAs. We can provide you with the information, but what we see is we need more encouragement out there about the social distancing that we need to see. Again, we hope that you don't wait for anything from us, that you all are the leaders that you are, and you put together using our website information what people need to know. So I'm happy to tell people in my voice, but them hearing from their local community in your voice. Local leaders, owners of radio stations or television stations. We are asking you to do this and to do it quickly. The more messages we can get out there, the better about what we have to do. One other step that we know we're going to be taking is we are going to be conducting a survey of all our outpatient surgical centers for their various supplies and the staff that they have. We know that if we see a surge of cases, we want to know where every piece of equipment is in this state, and we want to know every one of those healthcare providers that while they might have been working at a facility that provides elective procedures that they're not doing right now, that they are oh so needed, and that we know how to contact them. So something we're going to be doing to make sure that we can marshal every single resource at a time of need here in Kentucky. We will be reaching out from our end, and tomorrow we'll be providing a number for those that want to go ahead and volunteer that information. Finally, let me just mention a couple of the things that are always on people's minds. The first is that social distancing is not social isolation. That all these steps we take, and they're aggressive steps, but they're absolutely necessary steps to protect our people, don't mean that you have to shut off from society, and you shouldn't. It just means you have to change the way that you go about interacting with people. You know, especially if you live alone right now, make sure that you are using every means of technology to communicate with people. We want you to not only get through this, we want you to be really healthy when you get through it. And know that no matter what orders we put out, you will always be able to go to the grocery, go on a walk as long as you're engaging in social distancing, and that again, we will make it through. Also want to make sure that we mention about kids. Keep your kids on a schedule. We're on a Monday. I know that just about every school district has instruction that they're able to provide. Now's not the time, with the anxiety for kids or yourself, to start changing your schedule about when you get up or when you go to bed. Do as much as you can that is with that schedule every single day, and especially for those children, it's important. My wife and I did that this morning. You know, our kids are living through this anxiety, and they lost a dog, which is nothing like losing any individual that we have to this coronavirus. But even to see them and their anxiety reacting to that, the schedule was really important. We still did all of the same things with them, and you can see that it helped them today. We want to support our local businesses, especially those that serve our community. We talked about one that was providing free senior meals the other day. When you see that, step up and order from that business. And if you have the ability to help with personal protective equipment, please do. Finally, and then I'll get to questions, but this will answer a couple of them. A couple things that are always asked about. Number one is testing, and number two is this personal protective equipment. On testing, I am planning and I am pushing every single day to try to get to the point where we have more widespread testing. I spend much of my day, every day, right now on this alone. Our limitations are a couple, but it mainly goes down to the personal protective equipment. And that's a term that doesn't mean a lot to people, but it's about the types of masks that you need to wear. It's about the type of clothes you need to wear. It's having enough gloves. It's having enough nasal swabs to actually do the test. You have to have all those pieces together, and the truth is there is a critical shortage across this country, a major critical shortage. And there's a critical shortage here in Kentucky. But I spend all day today on the phone, following up on emails, and I'm doing it every day, doing everything I can to purchase as much of this personal protective equipment for Kentucky as possible. And yes, oftentimes we have to bid against the federal government or bid against other states. I can tell you, to me, I'm doing everything I can to buy as much of it for our people every day as possible. My job is to serve, to protect, and to do everything I can for the citizens of my state. And you bet we are going to do it. We are following every lead, and I got to tell you, most of them don't pan out. But we follow them no matter what, because if we can find that one supplier that can provide even more, the better. And we are having some success. It is not the level that we'd like to see, and no state is having that. But we're fighting for it every single day. Knowing that, remember, as you have to go into a healthcare facility or you have to sit on the phone waiting to talk to a doctor or a nurse or somebody working in that facility, they are heroes. What they are doing right now, knowing that there is not enough equipment, wearing masks that are sewn from home. We've got UK nurses that are producing their own masks and then wearing them. That is something truly special. It is a once-in-a-generation courage that I want all of them to know that we appreciate so much. So it'll be hard, but if you are at one of these facilities, and you'll be at it, if you're at it, you'll be scared, and you will have anxiety, just remember that they're walking into that same situation every single day. Give them the utmost respect that you can, and please acknowledge the sacrifice that they're making. All right, we'll take about 15 minutes of questions, and I'll go back and forth to folks that are here, and then questions on the page. I do want to mention we have 2 reporters that are here that had been in self-isolation doing the responsible thing. We appreciate y'all doing that. Welcome back. It doesn't mean you get to ask any more questions, but we will start with one of them. I think that's fair. Daniel or Joe?
I have 2 quick follow-ups on what you said. So you announced one new Fayette case. Was that the death, or is it a separate person who testified?
So the question is the Fayette County case, we announced the death or a separate person? It's really hard from the data and how we get it in right now. My belief, and it's just my belief right now, is that that is a separate case. But as they're coming in from all the different labs, and as the confirmation process is slow, it's going to take a day or 2 for all the data that you get from different localities and from us to match up.
And I want to make sure I'm 100% clear, because this weekend you seemed to indicate that the hotline was kind of being overrun and we needed to step back from calling that. So is it back to just, if you're worried, you can call the hotline now?
So the hotline, the question is about the different guidance on the hotline. And you're right, I provided different guidance today, and we're going to have to change guidance on different things as we go forward. The hotline is getting about 2,400 calls a day. We're okay with that. We're good with that. We want people to be able to call. But what we are finding is those that are sick but are not going into a healthcare facility to not overrun it. What the hotline is having to do is to then get that person to their local healthcare provider. We want to go ahead and get them directly to that provider, but we want you to call. So when you use the hotline right now is when you are nervous but well, right? When you wouldn't, and if you are sick but wouldn't have sought care if not for the coronavirus out there, and I understand how that would be on someone's mind. Call your local healthcare provider. Don't go in. Call them. They will want your call. But then make sure if you are truly sick and would have sought care or you were injured, that you go to one of those facilities. All right, one question here. How successful do you think Kentucky has been in flattening the curve on the spread of coronavirus? From what you are seeing, how are we comparing to other states? We are in the midst of it. And I believe we are taking aggressive and important steps. I believe there are steps that are and will save people's lives. But it'll be really hard to know exactly how we have done until we are further through it and have more data. Our numbers aren't necessarily jumping as fast as some other ones are. And believe in your heart, because it is true, that the sacrifice that you are making as Kentuckians is making a difference. No matter how many cases we have, and folks, even no matter how many deaths that we have, and each one is hard, know that you engaging in social distancing is meaning there are fewer cases and there are fewer deaths. Every time that you do your duty as a Kentuckian and as a patriot, you are protecting people. And they might not be that loved one that you're thinking about, but they are certainly a loved one that somebody else is thinking about. This is our test of humanity, where we are not just protecting people we know, we're protecting everybody around us. And so please follow that guidance. Joe, welcome back.
Referring to PPE and protective equipment, how many days of supplies do you think that Kentucky hospitals have right now, assuming the current trends of how many patients they're seeing?
The question is with PPE, how many days do Kentucky hospitals have, at least according to our information? We don't currently have a number for that because the system that's been set up around the country is everybody tries to go out and get what they can. It's not the best system. It's a system that's been created in shortage. And so I think it would depend on each and every hospital. We don't have a direct poll on that because we haven't asked our frontline workers to step off that front line and get a count of gloves and gowns and masks. What we're doing on the state side is just working and fighting and struggling for as much as we can possibly get. I do know that we're going to get a new shipment of one piece of critically important equipment because you got to have it all, right? If you want to do a test, you need the mask, the gown, the gloves, the swab, and the kit. And I know there are a couple other pieces in there, but if you don't have enough of all of them, then you can't set up and do it. But our goal right now is to collect as much from as many different places. And I will tell you, I'm willing to buy as much from anywhere of reputable equipment as we can get. Am I concerned about the reports the president is tired of the social distancing regulations recommended by health officials and would like them to end in 15 days? I think this is based on a tweet. I'm to a point where I'm not reading them, and I'm not terribly concerned about what is in them. I will say that Kentuckians need to be prepared for more social distancing than just that 15-day period. I mean, we have got to beat this thing. Kenneth, if you will once again put up St. Louis versus Philadelphia, which I know I'm putting up a bunch, but I just want you to look again at St. Louis. That is the better model about how people dealt with it. But look at the second rise. If we are not resilient and if we are not committed, we don't just face one escalation, we face a possible later escalation. So, we will take this week by week. And if we have to, we will take this month by month, and we ought to be prepared for that. But what we've got to be willing to do is what it takes. That's how we protect people. It's how we make sure there's enough health care for everybody. Yes?
I know we have a shortage of PPEs, but if we do see a spike as we're anticipating in patients, do you think we'll have a shortage of hospital beds in Kentucky?
So the question is, in addition to a shortage of PPE, will we have a shortage of medical beds? It depends on how well we do in making sure that we don't spread the virus and that we don't flood our healthcare facilities. Now, I will say our healthcare facilities are truly coming together. We are seeing people now very willingly, and I guess it's in order now, but cease elective procedures. But we have also seen people buy into it a little bit more every day as we've gone by. There's some new directives that have come down from the federal government about some things we can do to convert ventilators so that we can have more here in the Commonwealth, and we're going to continue to do that. We have plans in place to convert hotels into hospitals with additional beds if needed, because remember, as we look at the data right now, while there are hospitalizations, there are much fewer ICU needs right now than hospitalizations. So if we can have a clean, good place for folks with someone that can check on them, then we can make that work. We also have plans if we need to for pop-up facilities, and that could be through our National Guard or other areas. We're going to make sure that there are enough beds. What I want to make sure is that we have enough supplies for each bed, and that's for independent contractors. Do you have an updated timeline on that and any further details of what people can expect? So our good news today was on the SBA acceptance, which we already had, but they weren't processing them through our website. I made a call to HHS and to maybe as early as tomorrow that we have better news on unemployment insurance as related to independent contractors and others. We continue to fight for this. It's something that could be changed easily with the stroke of a pen by the president or an act of Congress, but we continue to work to find other ways to make sure that we can get there. I think I answered this question about are we bidding against other states for supplies and what it's costing. Yes, we are having to bid against other states for supplies, but I am willing to pay whatever it takes to protect the people of Kentucky to the maximum extent that we can. At the moment, folks, and some will take this the wrong way, I'm not concerned about money. I'm concerned about lives, and we're going to do everything we can to protect them.
Why are liquor stores being included on the essential business?
Well, all grocery and beverage stores have stayed open. That's something that we have seen in all of the other states too. And listen, as we go through this, we want to make sure that we are not changing people's lives in ways that we don't have to. Anybody else in here? I'll go back.
The VA hospital in Lexington, they're saying that we're hearing that they're not letting their staff work from home because administrators say that they're regulated federally. If the VA is regulated federally, does that mean that they don't have to comply with your state orders and recommendations?
The question is a report that the VA, the hospital in Lexington is not letting people work from home, and that they fall under federal regulation and not state regulation. And does that mean they don't have to comply with our orders? That's something I'll have to look at. They certainly do fall under federal regulation, but I don't think that necessarily means that they shouldn't at least be following our guidance. We have gotten some letters. We'll be able to file for unemployment. This is one that we hope that we can have news on as early as tomorrow. We want to make sure we're there for what Governor Beshear of Kentucky is doing to address the following recommendations made on a letter posted on KY Health News. Coordinating coronavirus testing. Testing should be centralized at designated sites. We're doing everything we can on coordination with our hospitals and others. Each of them has their own procurement ability to buy, and thus has different supplies right now. We're still working towards a goal of having drive-through testing here in Kentucky, and we believe that we're getting closer to it. Now, the way that would work is when we would originally be able to do it, once we have all the supplies we need, there would be a group that is the highest at, even when we can pop these up. We need to make sure those that are helping everybody else and putting themselves in harm's way or the most at risk of serious call with our hospital providers, and are we working on PSAs? We are working on some from the state, but today, I made the call for other people, go out there and leave.
Say how many beds they can convert to an ICU bed in the worst case scenario.
I believe that is what we are working on right now through our Emergency Management Operations Center that helps us through disasters. I'll get an answer for you on how many of those have provided them. But that is the group that is judging the extra capacity that we would need. And we are making direct contractual arrangements with additional facilities that we can convert and going through what that takes right now. We're already out there doing site surveys to make sure we can do it. All right, will boat ramps be closed and fishing lakes off limits? The answer, and what about marinas and campgrounds? The answer is they will not be closed provided that people can follow the guidance. If a marina and obviously a restaurant or a bar in a marina would need to be closed, and any type of forward-facing business, but as long as those can stay open. But let's make sure that we follow the guidance and we don't ruin things for other people. Are computer repair stores supposed to close? The answer to that is also no, provided that each store follow the guidelines that are out there from the CDC. We want people to be able to continue to get information, and at home, we want you to be able to continue to get entertainment because, again, the safest place you can be is at home. Are standalone tobacco shops with drive-thrus and vape shops with or without a drive-thru supposed to close at 8 p.m. tonight? The answer to that is they are supposed to close in-person service, but drive-thrus and curbside deliveries are still allowable. Do we know if Governor Beshear has signed Senate Bill 177, the Education NTI bill? Does he plan on signing it? I'm pretty positive that I have not signed it, at least as of today, but yes, I will sign it. Our school districts are already struggling. I'm going to do everything I can to help them out. What are the steps being taken to help speed up the process for those filing for unemployment? We've had those up today. Second question, how large has the increase been? We'll have to get you an answer to that tomorrow. All right, are these businesses impacted? Mobile grooming businesses, yes, they are closed. Pet grooming, yes. At this point, based on the honeybee analogy that we talked about, we need you to close. And laundromats. And the answer on laundromats, because we need it to sanitize clothing, which is incredibly important in this because the virus can live on it, is no, laundromats will not be closed, but you absolutely have to follow the CDC guidance on making sure people spread out and you don't have too many people in at any one time. And I know we're going to ask our local health departments to police this, because this is one of those facilities where something can spread if people don't do the best they can. But we also know if people can't wash their clothes, that it provides another mechanism for it to spread. And can you tell me if either the governor's office or public health is tracking other states' numbers for comparison at this time? And the answer is, I've said this a couple nights, but again, I hope that in the future people will look back and say maybe we were more aggressive than we needed to be, because that would mean that we really flatten this curve.
1,800, does that still exclude the private lab negatives?
It does. So right now, be sending it to us, but it doesn't mean that they are. And they've got $49 other states and territories trying to get it too. So no, we believe there have been well in excess of 2,000 cases right now. But again, don't just take that number of cases and the number of positives and make a decision or a judgment in your mind. Many people being asymptomatic, not showing any signs at all. There are undoubtedly hundreds of cases of the coronavirus, at least, that are out there in our community. So remember your two duties. Number one, do everything you can to protect yourself and your family from the coronavirus. And number two, make sure that you do everything you can, acting like you have it, not to spread it to other people. And the number one way to do that, and Kenneth, if you'll put up healthy at home, interact with their friends. Make sure that you are doing your part. Again, this is a time where we are all called upon to do our duty. One more.
Is the state considering releasing nonviolent felons who are older than 60?
The question is the state looking at releasing nonviolent felons that are older than 60? The state is looking at options to release certain felons, especially if they are close to the end end of a certain period of time before any steps we're going to make. We got to make sure, even in this context, to the guards, to the families themselves, and we have tried to take steps to have extra communication. We've gone about an hour, but let me end with while the World Health Organization says it's escalating, and while the Surgeon General says this is going to be a tough week, we are tough people. Every time in our history that we have faced a challenge, we have risen and we have defeated the adversary we face. But we are facing something different than any of us have seen in our lifetime. And it's one that is going to test us in our resiliency and our ability to be a good neighbor. But I know we're going to pass it. It's the first time in our lifetime where something that our country has needed and our state has needed doesn't bring us together physically, but makes us stay apart. Well, we can do this. Yes, it's hard. Every major challenge that we have ever had to face as a country and as a Commonwealth is hard. But I know we're up to it. Every generation that faces it. So follow the guidance. Understand that there are going to be more significant steps coming because this is the time where we're going to see things ramp up. And let's make sure as we end tonight that we think about that fourth person that we lost. That you focus on your family, you focus on the people around you, but everybody needs to take care of themselves too. We're all going to have moments in every day where we get overwhelmed and we feel overwhelmed. I am certainly amongst you on that one. Take a walk, get out, move around, hug on your kids, do whatever it takes. I mean, getting through this is going to require us to be resilient and to make sure that week to week or month to month that we can keep this up. So folks, we're ready. We can do this, and we're going to get through it. Thank y'all.